Understanding the difference between speech delay and autism, and how to help your child. Is your child not speaking fluently, or hasn't even said the first words as other kids his or her own age? As a parent, you are often worried and confused if it is a normal delay in your child's speech development, or could it be something bigger like autism? Although in autism, one of the assessments is to see if the child has speech delays, there are many other conditions that are also related to speech delay. Therefore, it is not necessary that your child with speech delay might be having autism. Autism is generally related to genetic disorder that is lifelong, and will need continuous support, where else speech delay may last up to 2 years old, and may caused by the following. Hearing loss. The child can't hear the parent's language to develop the skill to talk. Deprivation. The child doesn't spend enough time talking to adults, so she doesn't learn the language. Choice. The child has selective mutism and choose to not speak even without any medical problems. Multilanguage. A child who lives in a house with 2 or more languages will have difficulty picking up the language, and it will take longer time to speak. How to tell the difference between speech delay and autism. Language. Autism. Delayed speech and communication skills. Speech delay. Can say simple words, like mama, either clearly or unclearly by age of 12 to 15 months. Eye contact. Autism. Limited eye contact. Speech delay. Appropriate eye contact. Gestures. Autism. Limited ability to use gestures, pointing or facial expressions. Speech delay. Appropriate use of gestures, pointing or facial expressions. Behavior. Autism. May have repetitive behavior such as flapping hands or rocking. Speech delay. Uses expected behavior or movement. Hearing. Autism. Often does not respond when name is called. Speech delay. Typically responds when name is called. Actions. Autism. Seldom imitates actions, sounds or expressions. Speech delay. Able to imitate actions, sounds or expressions. Pretend play. Autism. Does not pretend play or use toys appropriately, may only play next to peers but not together. Speech delay. Engages in pretend play, can use toys appropriately, and enjoys playing with peers. How can you help your child with speech delay? For a child with speech delay, here are a few ways to encourage their speech development. Focus on communication. Talk with your child, sing along and encourage imitation of sounds and gestures. Read to your child. Read age-appropriate soft picture book to encourage your child to listen while he or she sees the picture. Use everyday situation. To build your child's speech and language, talk simple language through the day. Name the objects around, the food, name of the meal. Get help from a speech therapist. The speech therapist will work together with your child to improve speech and language skills, and also guide you on what you can do at home to help your child. For a child with autism, the following tips are helpful. Early intervention and therapy. Seek help from your pediatrician. If more tests are needed, a team of autism specialists such as child psychologist, speech therapist, and occupational therapists will be involved. This will help make a big impact on your child's coping skills, and you will be aware of how to handle a child with autism. Be consistent. Child with autism will have difficulty in applying what he or she has learned from one place or another place, for example, from school to home. Creating consistency in your child's environment is the best way to reinforce learning. It's also important to be consistent in the way you interact with your child and deal with challenging behaviors. Have a schedule. Child with autism will perform best when they have a schedule or routine. Set up regular time for your child's meal, school, activities, bedtime, and try to be consistent. If there needs to be any changes, inform your child in advance. Reward good behavior. Also look for other ways to reward them for good behavior, such as giving them a sticker or letting them play with a favorite toy. Create a safe home. Have a private space for your child to feel safe and relax. Visuals like color tape marking on areas he/she is not allowed will be helpful. Also, keep the space safe-proof, especially for a child who is prone to tantrum or self-injuries behavior. Pay attention to your child's sensory sensitivities. Some child with autism is hypersensitive to environment factors such as light, smell, sound, touch, and taste, while some of them are undersensitive. If your child behaves in a certain way, try to figure out what might have triggered them to make the stressful, calming, uncomfortable, or enjoy it. You will be able to troubleshoot or prevent problems that cause difficulties to your child. Get external help and support. Caring for a child with autism can be stressful and exhausting. Instead of doing everything by yourself, try to get some help, as it is essential for you to take care of yourself too.